Welcome back to another episode of the Huxley Morton podcast, the show where each week we speak to pharma company owners and industry leaders sharing their stories of personal and professional growth. We're now on series 4 of the show, and as you may already be aware, we're on a mission to help clinical researchers from around the world with tips, tricks, and inspiration. So if you could do me a quick favor and please hit that follow or subscribe button, it really does help more than you'll ever know. For now though, sit back, relax, and let's take things from here. This week, I am joined by Klaus Romero, Chief Scientific Officer at CPath over in Tucson, Arizona. Klaus, welcome to the show. And I believe that today you're not actually in Arizona. You've been quite busy with traveling of late.
Yes, indeed. I'm currently in California for work-related matters, and then a couple of weeks ago, I was in Europe, and it's getting back in the saddle after the pandemic.
I can imagine. Well, I'm sure you'll touch on some of the travels and what you've been up to. But I've given you a brief introduction there, Klaus. But for the wider audience, in your own words, if you can just give us a quick overview of CPath and what the business is all about, effectively.
Sure, happy to. So the CPath is the acronym for the Critical Path Institute.
Mm-hmm.
So the Critical Path Institute, we are an independent nonprofit that was started at the University of Arizona, at the College of Medicine in Tucson, in direct response to the FDA's Critical Path Initiative document. And so the abbreviation for the Critical Path Initiative at the FDA is the CPI, and we're the Critical Path Institute, CPath. We started in direct response to that very visionary white paper that came out in 2004, and even though it has been updated, even the original version from 2004 really sets the stage for a series of transformative steps that the FDA saw as needed to really transform and accelerate medical product development. And they specifically called for the establishment of public-private partnerships that could bring together the stakeholders and work on the process and leave the products in the competitive market and with the regular review processes that already existed. So that's how we got started, and we were born at the university. Then we got spun off as an independent nonprofit, and hence the name. And what we do is really create a very unique, neutral environment that has the legal infrastructure, the scientific infrastructure, and the regulatory infrastructure so that companies and regulators and academics and other government agencies can come together into this neutral environment and share information that they would not be able to share otherwise. And that information typically takes the form of patient-level data from the clinical trials from industry, the observational studies from academia, et cetera. And we transform those data into actionable solutions that address very specific bottlenecks in the drug development process. That's what we do.
Wow. Okay. All very interesting. So it's a PPP that was started kind of way back now. Did you say 2004, or was that when things initially, the idea came, and then your entity was a couple of years later? Is that right?
Right. So the Critical Path Initiative document from FDA came out in 2004. That same year, the kernel of the idea started at the university. And then a year later, in 2005, we were fully incorporated as an independent nonprofit.
I see. Okay. Well, it'll be interesting to hear more about the Institute in due course. But I guess in true Huxley Morton podcast fashion, I'm always interested to know a little bit about your background. So I always do a bit of research on LinkedIn. I see that you have been with CPath since pretty much the beginning. But look, did you always want to land yourself in the world of clinical research? If you can give us a bit of an overview as to how you stumbled upon this field, Klaus.
Oh, absolutely. So after medical school, I trained formally in clinical pharmacology and in epidemiology. And I started my career in the academic medicine world, that really wasn't for me. So
Uh-huh.
then I transitioned to industry, and I enjoyed it, but I was starting to feel a little bit anxious as to what could be out there that would, really be a home for professional growth.
Mm.
And in 2007, as a fellow of the American College of Clinical Pharmacology, I attended the annual meeting, which that year was in San Francisco. So this is September of 2007. The
Uh-huh.
entire meeting that year was focused on the Critical Path Initiative. In 2007, after 3 years of the Critical Path Initiative, there was a lot of interest in hearing how things were progressing with the Critical Path Initiative vision. And the keynote presentation at that conference was actually given by the founder of CPATH. And I attended the meeting. I was in the audience. I heard the vision for an organization of that nature, and I thought that first off, that's a brilliant idea, and
Wow.
second, that would be a really cool place to work. But I didn't give it any further thought.
Mm.
And then in the afternoon session, I was actually presenting some abstracts that I had gotten accepted based on some work that I had done in specifically model-informed drug development. Our founder, Ray Woosley, was in the audience for that. When the session concluded, we started talking. He started asking me a lot of questions. We kind of hit it off, and then he said, well, would you like to come work for me? And I said, sure. And that was that. So that was September of
Wow.
2000.
So two kind of back-to-back presentations. You were very impressed with what he had to say, and vice versa. And then it's just sparked from there.
Right. And so this was September of 2007. By December, I was in Tucson, joining CPATH.
Wow. Okay. What was it that Ray said at that time? I mean, I've just read a book called Drive by Daniel Pink, talking about motivation and vision and intrinsic motivation versus extrinsic motivation. What was it that, I guess, resonated with you in terms of that presentation that he gave that made you think, wow, that is an organization I could see myself working with? That, before he had even mentioned anything or anything was on the table, what was that vision?
So, yeah, it was a few things. So the first one was the notion of understanding that companies need to remain competitors.
Mm-hmm.
That's understood, but with their individual products, which is how they compete in the market, they still had to go through the same process of evaluation of safety and efficacy, and they were all facing the same bottlenecks. And so how could an organization just focus on the process and understand the bottlenecks and what kinds of solutions those bottlenecks needed? Mm-hmm. That was the first kind of brilliant component. The second part was the notion of being able to aggregate in a neutral environment a lot of data, a lot of patient level data, experimental level data, even in the preclinical stages, and then be able to deploy advanced analytics to provide those solutions. Advanced analytics, that's great, it's fantastic, but a lot of those advanced analytic methods require a lot of data, and those data are the hardest thing to come by. And so the notion of being able to get our hands on data, that was brilliant. That was really something that captured my interest. And then the other piece, which, at the time I had an appreciation for this notion of the regulatory science environment. So the science that regulators use to inform their evaluations. But I didn't really have much inside knowledge of what that really was, and how he talked about the notion of advancing that science of understanding how to evaluate medical products in terms of efficacy and safety. That was the other thing that captured me. And all these years later, the regulatory science has, in addition to clinical pharmacology and epidemiology and modeling from drug development, regulatory science has become a passion of mine. So that was really what captured me.
Kind of sold you back then, and you are still there all these years on, Klaus. Well, that just is a big thumbs up for that kind of sharing the vision with anyone that you're going to work with. I know what did things look like back then? Because look, if the organization had just started, you know, how many staff were there? I'm assuming that it was, I mean, I know all of us now communicate via Teams, Zoom, and everything else, but what did it look like back then? I know for me, I was traipsing myself into the city centre in London every single day. What was it like for yourselves?
Right. So we were in a small office in a specific part of town that is very convenient, kind of a central hub of the city. And it was about 12 of us at the time when I joined. So very much a startup environment.
Yeah.
Smaller organization, everybody wearing all kinds of different hats, making sure that we pushed the vision forward. And we were just getting things off the ground. So at the time, anything was possible on the one hand, but then we had to grapple with the realities of what low-hanging fruit we could identify to really sink our teeth into and have things move. At the time, the first consortium, which is an example of the types of public-private partnerships that we coordinate, the first consortium we had was PSTC, the Predictive Safety Testing Consortium, which is a consortium that still operates to this day. And that really provided the first meaningful victory for this notion of collaborative science, open science, and the advancement of regulatory science, which was the first ever qualification by FDA and subsequently the European Medicines Agency, and then PMDA, the regulatory agency in Japan, of 7 kidney safety biomarkers that could help better inform how to identify potentially problematic compounds that could generate kidney toxicity. That was the first victory. And that really provided the trailblazing opportunity to set up those review processes with the regulators, because everything that we generate, pretty much everything, we put through those regulatory review processes that did not exist before. So we've also been able to be part of the journey of those processes that the regulators have created specifically to evaluate these tools, not as products, but as tools that can help inform the decision-making in drug development. Wow.
Okay. And no, I guess when there was just 12 of you, what challenges were you faced with? Because I mean, to me, it sounds like quite a large scale operation in terms of getting all of those things done, particularly where, mentioning regulatory paperwork is what's kind of going through my head. There must have been quite a lot of admin work and red tape to wade through. So how was that? I guess that perhaps falls back to where you said that a lot of you were wearing many caps or hats, as it may be. What were the biggest challenges that you faced as an organization at that point when you were kind of 12, a head count of 12, and how did it then progress from there?
Right. So there was a vision, right? And sure, we had the first consortium, but in reality, it was the vision was very compelling. And when we met with the industry representatives and the different stakeholders, they all understood that the vision was fantastic. But then we had to convince them that even though the vision was great and it seems like a great idea, why hasn't this idea happened in 50 years? And the aspect of first the legal construct to ensure that there was a true neutral environment for everybody to come to and be fully protected. That was one of the biggest challenges. And so of course we had to work with
all I was thinking as soon as you said that was like, so how did you convince them? That was like honestly at the tip of my tongue. I was just thinking, so how do you do it?
Right. So we had to work with a lot of attorneys that were actually innovative thinkers for how to set up the legal infrastructure. Then we had to also make sure that they understood that we had the scientific wherewithal to be able to make that happen. Now, it's not like we just do everything in a vacuum and it's us leading the scientific development of these tools. It's the collaborative science environment and how we would be able to coalesce everybody and make sure that we were orchestrators, and we would do some hands-on stuff, absolutely, but that we would also provide the venue for true experts in specific fields to come in and be able to do their thing scientifically, so that the solutions could be generated and the tools could be advanced. So that was another big challenge. And then the other component of it was how are we going to run the prioritization? Because once we started kind of moving, then all of a sudden everybody wanted to be part of this. And at that time, at that size, it could be dangerous to just grow uncontrollably or overpromise that we could deliver on everything. And so that prioritization exercise was also an interesting path to follow as we started to set things up.
Wow. So it's, I mean, in that sense, look, because I guess being a not-for-profit organization, did that make that decision a little bit easier, where it was that kind of purpose over profit mentality that allowed you to hold back from growing too big too soon?
Yes. Well, there's this myth sometimes that nonprofit organizations are small and that they are only for charity purposes and that kind of thing. There are those types of nonprofits, but there are other nonprofits that are very industrial in their processes, and that generate significant amounts of revenue, and that revenue is put fully at the service of the purpose. That's the kind of organization that we've always strived to be, so that we can provide the community and the stakeholders with that added value that is our reason for existing. So that's that aspect of that side of the equation. The other side of the equation is that if you really want to set up a neutral environment, you need to account for the fact that your agenda needs to be an open book, and a nonprofit setup provides you with that opportunity to have your agenda be a complete open book. So that's that piece.
No, I agree. And you know what? I think sometimes if more companies were a little bit more open book and more transparent, they would, conversely get more business. It's as you say, just because it's labeled as a non-profit doesn't mean that it's not generating a good turnover and, it's, business savvy. So look, from that point on, Klaus, it sounds like there was a few challenges there, but clearly things were going well. How did things develop from that point? I mean, if you were to give us a snapshot of how the organization looks now and how that progressed over the past kind of 10, 15 years since you joined.
Right. So it's a great question. From the full startup mentality of everybody wearing 10 different hats and that being a very flux type of an environment, that was great, but we knew that we couldn't stay in that phase forever. And so the evolution to embrace some truly hardcore industrial discipline to drive the projects, and in that sense operate, like I said, with a very industrial mentality, was one of the steps that we needed to adjust to. It had bumps, right? Because in the startup phase, you tend to attract a lot of visionaries. And the vision is out there. You need to ground that, and you need to make sure that the vision becomes a reality, not just vision after vision after vision. So embracing that industrial discipline was a key component. solidifying the trust. That was another major component. We set up the legal infrastructure and all the procedures to make sure that we had an ironclad neutral environment. We had to protect it. And we still, to this day, we have to always think about every new thing that we do. How does that sit against our asset of neutrality? So that was one other thing. And then back to the trust component, since we were getting entrusted with data from industry and academia and patient groups, etc., we had to not only have the procedures to maintain data privacy, data security, everything fully accountable and with complete provenance, but the aspect of never breaking that trust from the organizations that were contributing the data. And that's another thing that we watch on a daily basis to make sure that we stay that trusted data steward for all those precious data points that we have access to.
Well, it sounds like that's part of one of the core values of the business. Just, you know, hearing from the initial speech from Ray through to the early days, through to you know to then the success and the growth. So I mean, what's the head count looking like now? How have things changed? And I guess with that, how has your role developed? Because it seems that things would have changed in a huge way.
Right. They have. Our head count is around 160 right now.
From 12.
From the 12 that when I joined. And so that shows.
Did you notice much of a difference at each point? Because often I speak to business owners and it's like, oh, okay, we went from, 10 to 20, no difference, 10 to 50, no difference. And then from that point, they seem to like start having to weigh up where the management layers come in and things like that. How did that go for you folks?
Pretty much the same way. I mean, there was we're small, we're a startup, everybody knows each other, very, very flat in that sense, as an organization. But then growth comes and you need to adapt, and your reputation grows, and so you need now you have things to protect for the continuity of the organization. And so that stage wise approach to growth, I've seen the great things that come with that and some of the headaches that come with that. Despite the seeming challenges, I think overall leadership of the organization has always had that people-centric mindset. Back to the neutrality component as an asset. The other big asset that we have is our people. Without the people, nothing happens. And so that's clearly how the organization has evolved. Put the pandemic into the mix, right? So we were just about over 100 people when the pandemic started. Now we're 160. Even when we were approaching the 100 mark, it was harder to keep track of who's who. From being an organization where everybody knew everybody, just keeping track of the people and the faces and the names was progressively harder. And then
are you good with names yourself? I mean, I'm quite good, but my partner Lucy is often terrible with names.
I'm better with faces than with names. Let me put it that way. But yeah, so that's one component of understanding who's who. And then throw the pandemic in the mix. When we had to all go remote, all of a sudden we had the setup already to be remote. So that wasn't too much of a challenge for us. But what was a challenge was the other part of the challenge, right? So the human factor, the psychological factor in the equation, just not being able to be face to face, the challenges with the meetings getting compressed in the day, nonstop meetings throughout the day, and then how you had to learn to adapt to have breaks and have a better discipline to ask yourself, is a meeting really needed, or an email or a text message just solve the, or even a phone call just solve things. The lack of the ability to be face to face in a room with a flip chart or a whiteboard to be able to have strategic conversations, that was a challenge that got hampered by the pandemic. And then we had to grow during the pandemic, because that was, a period of solutions continue to be needed, even more so now. There's a lot of unmet needs, and we need to drive things even faster now. So we grew significantly during the pandemic. So there are employees that joined us during the pandemic who have only seen the remote environment. And so that's another thing that we're navigating right now for a return to some kind of an evolved reality. That allows the flexibility, but also that allows the power of the face-to-face interactions and that kind of stuff. So that's another interesting conversation that is happening right now.
Definitely, and that's one I'm always interested in, that side of things. I guess, look, from my side, running a recruitment business, and hearing, I guess, the ongoing theme here about the trust, the integrity, being neutral. That's clearly something that runs through CPAF, and I'm just wondering how that has been conveyed via Zoom, because as you say, when you're sitting around in an office and you watched Ray do the presentation, he watched yourself, and then you could, it's quite natural to then go and have a conversation, but that sort of thing doesn't necessarily happen via Zoom, does it? So yeah, I'm just interested to know how that vision, because clearly you're doing well in the fact that you've gone from 100 to 160 over the period of COVID. So you're attracting the people. I'm just wondering, how that vision is now being conveyed, whether there's kind of marketing teams, talent acquisition teams, how it's all working effectively.
Right, and another great question. And so that's another area where we are evolving and keeping up with the times, and even trying to be ahead of the times.
Yeah.
Right, because another thing that the pandemic brought was the what has been labeled the big resignation. What that tells you is that there's a clear societal shift in the mentality of what really drives you to the workforce. It's no longer so much just the meet ends meet, or the paycheck that or the compensation package that really drives decisions. It seems to be more tied to do I get fulfilled, like truly fulfilled from a do I really like and enjoy what I do, and is what I'm doing having an impact or even leaving a legacy?
Yeah, I agree, and it's just so timely that I'm having this conversation with you today after finishing this book by Daniel Pink, because that's kind of what he is stressing about the evolvement of motivation over the areas, from having to survive to, yes, I need a paycheck, to now everyone wants that purpose, that vision. So it just seems bizarre that you have jumped on, and that has been the theme of what you've been saying has been going on at CPAF. So no, I definitely agree with that, Klaus.
Yeah, and because of the work that we do, that piece is and has been one of the selling points from the very beginning. And now all of a sudden that is like a great selling point for an organization where you are truly having a lasting impact through the work that you do in any capacity in the organization, because you're helping transform drug development. Yeah. And so to make sure that you contribute to first ever products to be cleared through the process because of the contributions that the organization made through the process in a partnership. That is quite attractive. Now, of course, the other aspect is that we also need to adapt to the fact that with the virtual environments, we also need to be with the times and be very flexible with the notion of people not necessarily all wanting or having the ability to relocate as part of a new job, and trying to turn that challenge into an opportunity for geographical presence in certain places, and how our people are always ambassadors of what we do, and how that really kind of creates a network, a decentralized network of ambassadors for this kind of work.
Definitely. Well, it sounds like you're doing this, the right thing on that front. That it's no secret, a lot of our guests have often gone on to be clients of ours. We recruit for them. They often get quite a bit of interest off the back of being on the podcast, because the senior leaders have, shared the vision, and firsthand that understanding the vision and the purpose of a business is often what draws people to want to work there. So that's no secret. And I think also just keeping up with the times and the rise of social media and being visible in the modern world is just so important. So it will be interesting to see how things progress for yourself and CPath. And look, before I come on to, I guess, your plans for the future, what have you learned, I guess, along the way, Klaus, about you? Because I guess from joining there, quite a long time ago now, 12 heads at that point, making that jump from 12 to 20 to 50 to 100, then having to weather the storm of COVID, which has been an opportunity for many. What have you learned about yourself as things have changed?
Oh, great question. So I guess the first thing is that CPath kind of found me, but at the same time, it gave me and even years ago, it's 2007. That right then and there, it gave me that professional home to really not even have a job, but have a passion for getting up every morning and continue to transform paradigms. That's another thing that has been a central component. I was not aware that I was so much into that transformation of paradigms, but not transforming paradigms like a bull in a china shop.
Yeah,
that's another thing that the regulatory science evolution has really taught me about how to make sure that you understand what are the boundaries for certain paradigms that you can shift, and once you move that boundary, then you can move to the next one, and once you move that boundary, move to the next one. It takes some finesse to understand that aspect.
Oh, so definitely. I mean, it's super complex. I mean, just trying to get change one habit, let alone a whole paradigm, and having that mind shift set shift it's a big deal. So yes, all very interesting there. And look, in terms of the business, then what's next on the path for CPath? In terms of, is there going to be more expansion? Are you going to try and consolidate things? Are you going to be looking at different partnerships? I mean, you mentioned, I think when you and I exchanged emails not so long back, I think you were over, I can't remember if it was in Israel or Europe, and now you're back in California. You've been a busy man of late. So yeah, what's going on? What's planned?
Right. So the globalization strategy. So that's one, right? So we've always worked with global regulatory agencies, but now is the time. And the pandemic, of course, put a monkey wrench on things. But now is the time when we're really solidifying things, starting in Europe with a full nonprofit extension in the Netherlands, right next door to the European Medicines Agency. That has been a clear aspect of what comes next. And we have a very talented engineer, scientist leading efforts there. And making sure that we now truly connect in the European environment, not just, whatever we do in the States, we want to replicate it everywhere else. That's not a good strategy, because every geographical context has its own cultural components, they have their own needs, and we can still leverage our core competencies, but we need to understand exactly in those contexts, what are the bottlenecks, and understanding those and making sure that we deploy our core competencies to help solve those bottlenecks. So that the European strategy is certainly something that will continue to be a major driver here. And then for us, as we are growing, to make sure that we are prepared to scale for that growth. And you mentioned something about consolidation. We have grouped our different public-private partnerships and consortia into different programs that have kind of a common theme. I think that's only going to get more solidified as we move forward. And then having a clear look at, when new opportunities arise, what is the best way to scale the growth so that it just doesn't mushroom out of control. That's the other thing that's coming.
Interesting stuff. Well, I'll certainly be paying close attention to how that all goes, Klauss, and it will be interesting to see what develops and which areas it develops in, because it sounds like you're trying to get that structure where the flexibility is there and you can then pounce on any opportunity depending on wherever it presents itself effectively.
Right. So it's striking the right balance between, okay, so these are clearly areas where we need to invest in ourselves as an organization to make sure that we're ahead of the curve of what's coming.
Yeah.
And of course, the growth in our data capabilities is definitely one investment that we're making. So that's that component of being very driven and strategic in that growth. And then the balance to also be flexible and adaptable to seize opportunities that arise that you may not have predicted before. That just pop up. Pandemic being one.
Yeah.
How do you turn a seeming challenge into an opportunity? And that mentality of, okay, so here's an opportunity. Can we seize it now? And if so, how? So that we don't just start diluting the vision of the organization.
Love that, Klauss. Absolutely love that. I almost feel like you've had secret access to all of the books that I've been reading and listening to of late, because there's a lot of themes that have been covered in that are now coming out of your very own mouth. But look, as I say, it'll be great to see how things going. I know that I will certainly keep in touch to keep tabs on how it's all going with interest. But look, before we close out the show, we always like to finish up with a quick fire questions round to get a few insights from yourself, really. So look, you've been kind of a long-term career man with CPATH, and we heard a little bit about your previous career prior to that. But look, what would you say is the number one piece of advice that you would give to your younger self, kind of way back?
Good one. Be patient. Don't pull your hair out when others don't necessarily understand and see the vision right away. Be very mindful of not just the content of what you're saying, but the package of that you use to provide that message. The packaging is just as important as the content. And make sure that you continue to develop as many orthogonal skills as possible, not just pure medicine and clinical abilities and scientific knowledge and skills, but human behavior, psychology, communications, social sciences, those kinds of things are really valuable tools.
So relevant, Klaus. I really like that one. And moving on to my next question. I've talked a lot, and as I say, there's been a few books that have been pinging away in my mind as you've been talking. But from your end, is there a particular book, website, podcast, resource that you would perhaps recommend for our audience, or just one that you're enjoying yourself?
Yeah, sure. So this is not a new one. In fact, a very old book, the Sun Tzu, The Art of War. Even though it sounds like, this is about war and whatnot, it talks about conflict and wars, but it really provides a lot of insight as to how to build and strengthen alliances, and actually how to avoid conflict, because conflict is the last resource. And so how you avoid conflict in the first place while ensuring that what you are driving for actually happens. That's definitely one that I would recommend.
What's that called? Susu or Zuzu?
Sun Tzu, Suntzu, Sun Tzu. And I'm probably butchering the pronunciation, but it's Sun Tzu, The Art of. You can just Google it as The Art of War.
Okay, I like it. Bit of a different one there, Klaus. We've not come across that previously. And look, we've already talked about the massive growth that CPath and yourself have experienced since you joined. You talked about the vision from Ray when you first saw him, but look, what are the top 3 qualities that you value most when building your direct teams or building the business in general?
Yeah, great question. Lead by example, be transparent, and make sure that you understand what everybody brings to the table to strengthen the driving towards realizing the vision.
I like that. I mean, this is always one of my favorite questions, because it kind of then I almost know the answer, having shared the conversation previously. So yeah, very in sync with everything that you've said today. But to now switch things outside of work, because look, we spend an inordinate amount of times at work, but we're all human beings. I think through Zoom we've seen people's bedrooms, kitchens, you name it, we've seen it, sometimes too much. But outside of work, Klaus, what do you do to relax, to enjoy yourself, in everyday life?
Sure, I'm an avid swimmer. I swim pretty much every morning and evening.
Yeah.
My wife and I, we don't have kids, so that gives us a lot of flexibility to travel together. So certainly for work or pleasure, traveling together is one of the things that
favorite destination, Klaus. Favorite destination.
Oh, sheesh. Great question. We really like Portugal. I can say that much. And we really love Cape Town. Those would be probably in the top 2. And then I'm also an avid musician. I've been exposed to music since I was 5 years old. I play multiple instruments, and especially guitar, and I have dabbled in actually designing and building guitars.
That's right. I remember now, because you were showing me a couple of the collection when we spoke quite a while back. No, I like that. As you say, like, it's good to be a well-rounded individual at times. And I think those life experiences allow you to kind of influence, persuade, and share the vision of whatever it is you're doing, whether it's traveling, whether it's work. So no, I like all of that, Klaus. But look, to wrap up the show, my final quick fire question is about your number one golden rule for both life and business.
Oh, number one rule, be transparent, and make sure that people understand that you're trusting them when you're being transparent.
Definitely. I like that. I like that a lot. Well, look, Klauss, it's been an absolute pleasure having you on the Huxley Morton podcast. Look, for anyone that wants to reach out to you or to CPath, what is the best way to get hold of you folks? Is there a website, LinkedIn? What's?
We have a LinkedIn presence. We have a website. You can shoot me an email. You can share my contact information as part of the show. That's easy. And, yeah, that's the way.
Excellent stuff. Well, look, Klauss, it's been a pleasure having you on the show. Thanks again for being a part of the Huxley Morton podcast.
No, thank you. I enjoyed it. Thanks so much.